And please give all your energy and attention to this awesome presenter too. He is Dr. Alessandro Porcella. He works at the he is the clinical director at Holistic Care, an American Biodental Center. Holistic Care is an integrative medical clinic specializing in stem cell therapy, integrative oncology, biological dentistry, regenerative medicine, and corrective chiropractic. Together with his team, they pioneer innovative and personalized treatments, protocols, and wide range of conditions. Dr. Porcella had also worked closely in biological dentistry for over 10 years before completing his medical degree. And he's going to be talking to us about stem cell therapy, repairing, renewing, and regenerating the body. So please welcome Dr. Porcella to the stage.
First of all, thank you, everyone. I've known Jean and a few of you for a few years now, so being here is truly an honor, and honestly, I was mentioning it, seeing the community that you guys have built here is absolutely beautiful. I mean, the energy yesterday, the energy today, it's amazing. So truly an honor to be here, and congratulations to you guys also. So, to get started a little bit, I always ask this question, and it's a little bit different answer depending on the group of people I'm kind of presenting to or talking to, but who here has heard of stem cell therapies? Okay, and who here has done a stem cell therapy of any kind? Okay, the reason I ask is there's a lot of information between what is stem cell therapies, inside the States, outside the States, the different types. There are certain things like exosomes, which sometimes get sold as a stem cell therapy, but they are products of stem cells. So part of the presentation, especially in the beginning, I'm going to kind of touch about the different types of therapies. Some are more commonly used, some are more common in the States, some are more outside. All of them have some benefit, obviously, and a lot of overlap. But it's just so that you guys are aware of that. So they kind of mentioned it just quickly, just so you have a little bit more about myself. I'm a naturopathic doctor. When I decided to go back to study medicine, I went the naturopathic route just because, similar to what we're doing here and talking about here, I found that connecting the little bit of the conventional with the alternative, with the natural and the holistic, just called to me a little bit more than just going down kind of one specific route. The clinic where I work in, which is two names, Holistic Care, the medical, and American Biodental Center, the dental, has been around for 26 years. We started with the holistic dentistry and kind of expanded from there over the years. So got a unique perspective in working with integrative teams. We have chiropractors, nutritionalists, acupuncturists, MDs, NDs, a little bit of everything there. And we are one of the authorized centers for stem cell production in Mexico. So that is one of the benefits that we have, is we can actually produce the stem cells. And I'll talk a little bit why that's very important. And then, so before I even became a naturopathic doctor, I was working in biological dentistry. So if you also have questions about that, I'll be happy to answer. And then for the last 4 years, I've been working closely with our medical director and stem cell specialist, Dr. Suye, who is also here, and if anyone has any questions in Spanish, because I noticed there's a lot of Spanish speakers, she'll be happy to take them. And then a few specialties over the years of additional trainings that I've done. So stem cell therapies falls into regenerative medicine, which I feel like I don't have to explain too much to this group what that is, but the focus is the repair, regeneration, well, even replacement in some cases now of cells, tissues, and organs in the body. So it encompasses a lot of things. So not just stem cells, now we're getting into future treatments, more advanced treatments, which are, tissue engineering, 3D bioprinting, gene therapies, like Ivan mentioned, even nanotechnology. So what are stem cells, right? The kind of basic question, the starting point of all this. So stem cells are unique and powerful cells in the body with remarkable ability to develop into many different cell types, from muscle cells to brain cells, self-renew, meaning they can divide and produce more stem cells. Now, It's not like you're getting the stem cells and they're going to go in and turn into always the muscle tissue or the nerve tissue. A lot of times what the stem cells are doing are releasing certain factors that stimulates that in your body. So that's also an important thing to kind of know. But key characteristics, self-renewing, differentiating, and they're in that neutral blank state, which is what allows these therapies to be used even from donor tissues and be accepted by the patient. And I'll go a little bit more into that right now. So I felt like this slide, or we felt like this slide fit perfectly with a little bit of what we were talking about yesterday about that like divine energy or divine presence in our bodies. You know, this shows when babies are born as a child, you have a higher concentration of stem cells in your body. Your regeneration, your level of regeneration is a lot higher than it is when you're an adult. And you see that, right? You see a kid running around and they fall down, smack into a wall, they cry a little bit, they get up, and then they're running around again. Their inflammation is low, fibrosis is low. When you get older, you know, unless you're taking really good care of yourself, you pick up a bag the wrong way and you hurt your hand and it hurts for a few weeks. And you're like, really? That caused that injury? Like, what's going on with me? So this is showing how there's that change. And why is that change? Well, not just, you know, aging, there's changes in the body, but we're also being exposed to a lot of stressors, environmental stressors, mental, emotional. We're dealing with all these other things that are going to cause certain diseases in our body. So that's actually where the stem cells come in, and you'll see where I am going to talk about longevity and how it helps in that. But obviously, there's a lot of other conditions that kind of go along with that you know, appear over the years because you've been exposed to certain environmental issues, or because, you know, maybe you found this group later in life, but for the first 30, 40, 50 years, you didn't know. So your diet was horrible, your exercise was horrible, you weren't taking, you know, supplements, taking care of yourselves. So you get to a point where you're dealing with some sort of illness or disease. Well, the stem cells are so versatile that you can use them for prevention and longevity, but you can also use them for these other diseases. So that is one of the key components. So what are primary sources of stem cells? These are some of the more common ones you see. The first one are the embryonic stem cells, and I will say this is the most controversial, it's the most unethical, it is illegal in many places because essentially you have to destroy an embryo to get them. The second is the adult stem cells, somatic stem cells. These are found in different tissues in the body, the main ones being bone marrow, adipose, fat cells. Those are the ones that are used a lot in, for example, in the US. The reason being just because of regulations in the US and because you can't necessarily expand cells in the US. What they do is a lot of these procedures, and I don't know, maybe some of the people that raised their hands here, that's the type of procedure they receive, where they get your own stem cells from bone marrow, from like a mini liposuction, and essentially separate them out there from that tissue and then put it back in. They have their benefits. Obviously, they're your own cells. There's no risk of rejection or anything like that. It'd be extremely rare. Then you have another type, the induced pluripotent stem cells. These are essentially cells, adult somatic cells, that in the lab they essentially manipulate them to become in their like stem cell state again. And then perinatal stem cells. These are the stem cells that we mainly specialize in. I mean, we can do many of the other ones and work with many different types of tissues, but the ones that we specialize in are the ones that are found associated with birth. So that means umbilical cord blood, umbilical cord tissue, amniotic fluid, or even the placenta. This is where us, with our own lab, we work mainly with, for example, umbilical cord tissue, the Wharton jelly that's found in donated umbilical cords. There's a whole process in screening a patient to donate it. There's a whole process in screening the mother and screening the cord. But from that is where we can cultivate and in Mexico expand the stem cells for these treatments. But again, these are neutral blank stem cells that we can give to any of you without causing any immune reaction. And then the big difference, again, autologous versus allogenic. So autologous just means that they're coming from you. So those are the ones that you mainly see, for example, in the States, where they're, like I mentioned, from the bone marrow or fat tissue, producing those stem cells to reapply to you. Allogenic are from the donor. So in our case, again, they come from umbilical cord, where we cultivate them and expand them in the lab. Now there are, and I'll go kind of, well, these are, the mesenchymal stem cells are the ones that I'm going to focus a little bit more on. So mesenchymal stem cells have a lot of benefits. There's a lot of information on there. You don't have to read it all, but essentially they can differentiate into different types of tissues. So osteoblasts, chondrocytes, and adipocytes, sorry, muscle cells, nerve cells. Now some of that obviously is under certain conditions. In the body, where they come in and have a big effect is that immune modulating effect. So I think that was actually kind of a question that you asked just right now with the gene therapy. The stem cells, that's where they come in and play a big role, is if someone has an overactive immune system, say autoimmune condition, the stem cells help to kind of suppress that. And not so much suppress it, but bring it down to the baseline level, like normal. Now, if you have a low immune system, say you just had a major surgery and your immune system, you're immunodepressed, that's where stem cells help to boost your immune system. So that's the very critical part of, why you can treat so many conditions is because it's not just like an immune suppressant, like a steroid. It's actually helping improve the function of your immune system along with the regeneration of other tissues and lowering inflammation and et cetera, et cetera. So I kind of touched on it, but these are other... Oh. Everything okay? Everyone okay? So this is where different types of tissues, again, a lot of people don't know. You can even get stem cells from your teeth. So it's not a lot, but they do extractions of like molars and you can actually cultivate stem cells from there, obviously a smaller amount. Now, again, clinical benefits is the tissue repair, the regeneration. How does that work? And we always get asked, how does a stem cell know how to, get to the area of the injury? Well, in the clinic, there's two ways we kind of address this. One, with major damage to, say, like a joint, we can inject directly there. But in IV, it goes into your circulation. How does it know? The same way your body knows, right? There's markers that your cells are using. There's cytokines it's releasing. There's essentially messenger molecules that it's using to communicate. The same way when you fall down and you hit yourself and you start getting a bruise, you don't have to tell your immune cells and your red blood cells, hey, go to my hand, I'm bleeding. No, it reacts to those markers. It reacts to that inflammation. Stem cells do the same thing. So stem cells go in, they start circulating, wherever they find inflammation, where they find low oxygen tissue, that's what pulls them, and then that's where they start working and releasing their own messenger molecules to stimulate your immune system, stimulate your healing. Now, that does bring into the question of, obviously, if you just had a major surgery or anything like that, and you're getting a stem cell treatment, well, a lot of the stem cells are gonna go to that area. So if you're doing it for longevity, then you probably want to do a treatment for the post-surgery or the post-procedure, and then down the road, a few months later, do it more for the longevity and anti-aging. So like I mentioned, immune modulating, the anti-inflammatory effects, I'll be honest, you're going to see this kind of repeat throughout all these slides, but that is, again, why they're so versatile, why you can use them for so many conditions, because it hits all these different areas. And now, everyone has inflammation, right? Everyone, even if it's low-grade inflammation, and that's such a big contributing factor to a lot of diseases and issues that we're dealing with nowadays, and to aging, right? So this is where it's going to work. It also does a little bit of angiogenesis. So that's one thing that we're looking with Ivan and the gene therapies now, is combining the stem cells with the gene therapy to kind of have that synergistic effect, where we can do the stem cells in IV and we can do the gene therapy injection into those muscle bellies or into the hair. So really exciting things. Okay. So also antifibrotic, so scarring, we see this a lot when we do stem cells on like facials with PRP. We've gotten rid of old scars or pigmentation. It also helps with like liver fibrosis and kidney issues. So it is a very unique thing that you can use it for inflammation, and you can also use it to repair old, essentially scar tissue or fibrosis. And neuroprotection, so it's very effective in neurological conditions because stem cells have been found to have that benefit of essentially having like an affinity for the nerves and lowering the inflammation of the nerves. This I kind of left in. So this is one of the reports that we do when we do testing in our lab. It's very important that wherever you get stem cells from, whether they be your own or another place, you really work with someone that's certified and experienced. Unfortunately, like many things nowadays, as it becomes popular, people start becoming experts in it. In TJ, we have a lot of that, unfortunately. We know a few doctors that up to 6 months ago, they didn't know anything about stem cells, and now they're the experts in the area because they did a great marketing campaign. So it's very important that you know if the stem cells are not being produced there in their own lab, that they're working with a lab that is actually certifying the quality and the quantity and the whole process too. When we screen, for example, the umbilical cords that we get from the donors, I mean, we're checking vaccinations, we're checking genetic issues, we're checking viral, bacterial, fungal infections. We go really deep into that. And that's really critical to make sure you're getting, a good quality product or stem cells, but also that you're not going to have complications from getting something that was not properly done. I keep looking over there, but I forget I have a screen here. So this is just really quickly. The contraindication, really the biggest one is cancer. There's some information, some people say that in the future it might be beneficial because stem cells help improve the immune system. But the thing is, the stem cells don't realize what is cancer and what is not. So the same way they can stimulate your immune system, they can stimulate the cancer growth. At our facility, that is the first thing we do. We do a screening, general lab work and then specialized lab work. Then we start screening for cancer. That is with blood work, that is with ultrasound, x-rays, MRI if we need to. Once we see the patient is clear, then we proceed into the stem cell treatment. If we see that there's possibility of cancer or any cancerous growth, then at that point we kind of shift it into a cancer treatment. There are other cells, they're not technically stem cells, they're immune cells, like dendritic and NK cells. That is what you use in those treatments. But it's very important to know, especially if you've had a history of cancer, there's a certain amount of time you have to wait and get cleared before you do any type of stem cell treatment, as a precaution. And it is evidence-based medicine. I mention this because a lot of people still think stem cells are this new thing. And maybe in the States, it seems like a little bit newer because of restrictions here. But outside of the States, it's not a new technology. It's a growing technology for sure. But for example, PubMed, this was from like 7 years ago, there was already 56,512 studies being done with some sort of stem cells. That number is growing every year. Again, this actually stops in 2015. And the thing is, up until a few years ago, and even still now, many of these studies are being done outside of the US. So the US is starting to catch on a little bit, but you can see China, Korea, the rest of the world is pretty far ahead in that sense. So application of mesenchymal stem cells in different pathologies. And I'm gonna go a little bit quick on this because I'm horrible on time management and I'm either gonna go too fast or the red light's gonna get shone on me. Again, this I've mentioned a little bit. This is kind of the standard protocol that we do. If not exactly like this, something similar to this is what you want to see from a provider. So again, it is a medical treatment, so you do need to do a medical consultation first. You do need to be checked and make sure you're cleared, make sure there's no tumor markers, there's no tumor growths. If that's fine, then we like to start the process with a detoxification of the body. Why? Because we want to prep the body for the stem cells. You can come in and we can do an IV of stem cells right now, and you'll see benefits, sure. But if we prep the body, you get a lot better benefits, right? And it becomes a lot more synergistic. So the first thing we do is kind of a light detoxification of the body. What can that be? That can be chelation for heavy metals. That can be improving liver function, glutathione. We have some IVs that are for like liver detoxification, opening up those detox pathways. And then we start building up the body. How we do that in our facility, we use a lot of combinations of IVs. So luckily we have access to about like 25 IVs that we can kind of choose and customize for you. What we do there is we customize to what you're looking for. So if you're looking for longevity and anti-aging, we have some for that. If you're dealing with a neurological condition, we have that. If you're dealing with dementia and Alzheimer's, then we kind of focus on that. We combine that with hyperbaric, red light therapy, even physical therapy, chiropractic. And then we do the application of stem cells, and then we do long-term recommendations for our patients for at home. That can be supplements, nutrition guidance, whatever needs to be done. So common things, like I mentioned, autoimmune, neurological, chronic disease. Like I said, really almost anything but cancer. How can they be applied? Intravenous. Intravenous is amazing. The people that we've done just intravenous therapies, they have amazing results that they see. Some people come in for a digestive issue, and then a month or 2 months later, they're telling you, hey, you know what? I came in for my stomach and my hands don't hurt as much. I sleep better. You know, I feel like my cycles have regulated a little bit better. So that's the beauty of the intravenous. Now we do have intra-articular, which is joint injections. We work with a lot of chiropractors, so we do get a lot of like cervical and lumbar problems, joints, knees. We get a lot of athletes too. The aesthetic treatments, hair, face, they can be done in the operating room specific to organs, so they can actually go and do them like in the heart for the heart tissue. Around the lesions, so they can be cuts. As long as there's not infection, we have to kind of clear that up first. In the eyes or around the eyes, like I mentioned, hair, intraoral. So that is something that we've been doing a lot with the periodontal, since we have the dental clinic there. For a lot of our kind of bone regeneration, a lot of periodontal issues, you can use stem cells there. And then intrathecal. Intrathecal means they go into the spine. That is done by a specialist. We do that in the operating room. That is a lot of times used for neurological conditions. We have a lot of autism that we see, so we use it for autism and for cognitive issues sometimes also. So just a kind of quick rundown, metabolic chronic disease, which is kind of the pandemic right now of the chronic diseases, so diabetes. A lot of with diabetes, as many of you might know, I mean, it starts with the blood sugar regulation, the insulin, but then as it progresses, you start having other issues. You start having retinal problems, so eye vision issues, you start having issues with your kidneys, you start having issues, peripheral neuropathy. Stem cells, because they're so versatile, and especially when you do them in IV, they can start not just helping with the insulin and your glucose levels, but they actually start helping with those other issues and repairing that damage that's going on in your organs. At the same time, there's evidence to show that it helps with the receptors on the cells, on the pancreas, so it helps to stabilize kind of one of the core issues going on there. And similar to Ivan mentioned, there's benefits for the peripheral vascular disease that is usually a complication and ends up leading into a lot of amputations for diabetic patients. This is one part where we are looking at possibly combining the gene therapies into doing the stem cells with that to see if we can really improve the angiogenesis and regeneration of the capillaries and the blood perfusion into those tissues. Yeah, there's actually a study that was done in mice where actually showed angiogenic effects, so production of new capillaries And this was done with stem cells. So kind of what I mentioned. And then autoimmune, this is where it really shines, to be honest. Well, it shines in everything, but it really shines here for us. We see a lot of autoimmune patients, and as you can see, there is a lot of autoimmune, and this is a small list of very, very varied conditions. But this is where it really comes in because of that immune modulating effect that I mentioned. It really helps to control and balance out the immune system. So rheumatoid arthritis, for example, is a lot of people do not respond well to the medication, to the initial medications. A lot of the other a lot of medications in general have a lot of side effects. So this is where a good alternative can be the stem cells, because not only is it helping to regulate the immunity, or the immune system, it helps to regenerate some of the damage to the structures that's being done. And by lowering the inflammation, you're essentially kind of replacing those anti-inflammatory medications. Now, in some cases, you can't completely get off of them right away, but it helps to at least get the process started. And in many cases, when it's progressed too far, you at least don't have to be taking such a high dose of these medications or so often. And multiple sclerosis, this is another condition that we see a lot of. This is where we do the IV stem cells, the intrathecal. We do supplementation, hyperbaric oxygen, transfer factors, which help stimulate the immune system. And while it's not on there, a very big thing for our patients with multiple sclerosis is the dental. A lot of our dental patients have amalgams, root canals, old infected bone that we need to clear up to get the full benefits of the treatments, even with the stem cells. So again, neurologically, they help to modulate the neuroinflammation, they help to lower the inflammation of the nerves, they're protective for the nerves, they help to suppress that overactive immune response, and then they promote the tissue regeneration of the cells and microglia. So I'll go a little bit quicker because I already got the green light. So cardiovascular, so when someone has, for example, a heart attack, there's changes in the heart tissue. Ideally, if we could do it immediately as they get to the hospital, you would have amazing results. Unfortunately, we live in a world where you don't find stem cells in hospitals. But even then, if it's already been established where the heart cells are damaged, it can help with the maladaptive reforming that happens around the heart and essentially improving the efficiency of the heart post-damage. So musculoskeletal, like I said, we see this a lot. Osteoporosis and osteoarthritis, this is where we see a lot of benefits. Some common treatments that are used are prolotherapy, PRP, and mesenchymal stem cells. At our facility, we always combine mesenchymal stem cells with PRP, your own PRP, and we inject it directly into the area. So these are kind of some common injection sites. But really, any joint can be done. Some obviously have to be a little bit guided and or done in the operating room. So again, what are they doing? They're releasing those growth factors, they're stimulating the cytokines, the extracellular vesicles, those are what the exosomes are. So they're helping to promote the tissue regeneration and the repair while lowering the inflammation in that area. And I want to make sure, why are we here? Longevity, right? So mesenchymal stem cells, they have a lot of benefits for this. A lot of what we're talking about, the repair, the regeneration, the reduced inflammation, that, what is the word? Inflammaging. The chronic low-grade inflammation, which is a major driver of the diseases that we unfortunately experience as we age. It really helps to bring that under control. It helps boost your immunity, which again is something that drops as you age, and especially if you're not taking care of yourself. Like a lot of people here might be the exception, but outside of here, most people wait until they get sick or they're dealing with something to actually start looking for help. And obviously cellular health. So they've been found to manage the senescent cells, which are essentially the zombie cells. There's studies that show improvements in telomere lengths. There's evidence to show benefits with mitochondrial health, all key drivers for longevity and proper cell health. And So really quickly, monotherapy, polytherapy, I think you guys realize that because of the clinic that we have, how we do it, the combination by itself, very beneficial. In combination, even better. What are common things you can use it with and combine it with? Well, we do IVs, hyperbaric, peptides, infrared therapies, chiropractic, botanical medicine, PRP, PRF. We do EBU and ozone in a lot of our treatments. Exosomes, gene therapies, all of this can be combined with stem cells, and it really increases the potency of those cells. And that whole person treatment, I mean, I think everyone here can agree that that's the most important thing. And if you want to live and be immortal, and you have to address it by different means too. It's not one pill that's going to, make you immortal or give you that, optimum health. It's addressing different factors in your life and doing different things to really address all those different environmental factors that are coming at us and really bringing us down and killing us. So by addressing a patient this way, and that's why, again, I became a naturopathic doctor, you really see the benefits, both short-term and long-term, in these therapies. So thank you so much.
Thank you. Thank you so much, Dr. Porcella. Thank you for staying.
Yeah.
I believe we can
not
have
ready.
some questions. Questions, everyone? Here? Thank you.
Thank you. Two questions. One, you mentioned the detoxification that you go through with patients. And I wonder if you recommend that for people who are not patients or just trying to improve their health. And I wonder what those steps would be.
So it depends. And we do recommend it. And like I said, we live in a world where we're constantly exposed to toxins from food, air, anything, right? So doing detoxifications is always good. Now, there's different levels, obviously. Someone that's been exposed to heavy metals, whether it be because of mercury amalgams or because they worked in an industry where they were just exposed to it. Obviously there, you need to kind of tailor a more specific treatment for that. And for example, we do chelation therapies with IVs. Someone that obviously takes good care of themselves and watches more what they eat and everything, then, every so often they can do a lighter detoxification. In that sense, what you're doing more is stimulating like your detox pathways. You want to sweat. You want to make sure your liver functions good, your kidney function. Everyone forgets the kidney until it's already messed up. But everyone focuses on the liver, but the kidney is also another important. Even breath work. Breath work, everyone forgets that lungs are a detox pathway also. So by doing breath work, you're detoxing in that way. At that point, I would say you have to work with kind of someone to see at what level kind of detoxification you are or you want to hit. Yeah. But definitely, I think it's beneficial.
Oh, great. And just quickly, you mentioned earlier in your presentation Parkinson's disease. I wonder what the impact on that is.
Yeah, we've had a few Parkinson's patients over the years. So that's where we haven't gotten to a point where we can cure Parkinson's, but we can really help to manage a lot of the symptoms and even kind of reverse some of those symptoms. The earlier you catch it and you treat it, the better long-term results you do get, I will say that. That is where we do the combination of, one, obviously long-term supplementation and guidance there, but the IVs that we use in the hyperbaric, for example, we tailor to neurological conditions. That is where we do the IV stem cells also, and we do the intrathecal. So that is where in the operating room, the specialist has to inject stem cells into the spine so they can go into the central nervous system and really help repair that more at the source. But we do have good results with Parkinson's patients too. Yeah. Again, it is something depending on the level of it, they do have to come back and do follow-up treatments after so much time. Yeah.
Anyone else? Oh.
Are stem cells being used to reverse or treat like vision deterioration?
Yeah, so it depends on the issue that's causing it. But for example, at our clinic, we do, for like diabetic retinopathy, we do the IV stem cells there, and they work well because not only are they targeting there, but they're targeting obviously systemically. Dr. Suya actually does retrobulbar, so they go and they apply not into the eye, but underneath the eye, the stem cells, and they essentially, it's like the joint injections just for the eyes, and we usually combine that with the IV stem cells. Again, it depends how extensive the damage is, it depends exactly what type of damage it is, but there are improvements to that. Yeah. That is something where, even at RadFest, we were talking about red light therapy, and we want to kind of do the combination to see, yeah.
Yeah, one comment and then a couple quick questions.
Yeah.
There are at least 4 of us in the room here have done birth tissue stem cells,
Okay.
placenta or umbilical cord. And so what you do with imaging and detox, we didn't do that. We were in and out kind of thing. So,
Unfortunately, a lot of places.
yeah, so I just want to commend you for that.
Thank you.
A couple quick questions. One is, how long does it last? Like birth tissue stem cells. How often do you have to do it? And then the second question is the age-old question: stem cells versus exosomes.
Yeah.
Which is better, and what's your take on it?
Okay, so how long they last, different studies have shown for like IV stem cells, they can last up to a year in working. Now, obviously there's kind of a peak in that too. For patients that are dealing with chronic issues, that's where we usually have them do kind of a follow-up treatment, anywhere from like 4 to 6 months or 6 to 8 months. That we see in the intake if we recommend a little bit sooner or a little bit later. For joint injections and kind of the local, it's been found to be like a year to a year and a half. Now that doesn't mean that at the year it's like, oh, stem cells are gone and everything reversed back to what I was. No, because since it is regenerating tissue, then obviously if it regenerated cartilage, say in your knee, it's not like in a year that cartilage is going to disappear magically. No. So you do see improvements. It's just at that point, it's where you notice, well, you know what? I'm about 90% better, but I still have a little bit of pain. That's where you probably want to do a follow-up injection. If you notice it's completely gone, then you might want to wait. If you want to do it, there's no problem, but at that point, you might just want to wait until maybe 2 years or 3 years. But yeah. And then exosomes, so exosomes, like I mentioned, are a component of the stem cells, something that the stem cells release. They have a lot of good benefits, obviously. They're very powerful in anti-inflammatory effects. So if you want to kind of quickly bring down inflammation, that's where we use exosomes in IVs, or we use exosomes a lot in neurological conditions, nebulized, because stem cells don't cross the blood-brain barrier easily, but the exosomes do because they're a smaller molecule. However, the stem cells, they do a lot more. So they release exosomes, they release other growth factors. So overall, you get more with the stem cells than you do with exosomes. But using one or the other, or combining them, you still see benefits and improvements. That's why 90% of our treatments are mainly stem cells, but we do combine it with exosomes when we feel like there's going to be that benefit or synergistic effect with it.
Otto here. Thank you.
That was so much information, thank you.
Yeah,
Can stem cells be activated by infrared light therapy or infrared laser?
Like your own stem cells?
Yeah.
Yeah, and there's actually a lot kind of research going into that, and there's a lot of companies that are kind of looking into that. Because, and I forgot his name, there's a doctor out there that's specialized in essentially activating your own stem cells through, whether it be through light therapies, there's sound therapies, through botanical medicine, through different factors. The thing is, as we age, your stem cells, you might be 60 years old, you have 60-year-old stem cells that have been exposed to a lot of these stressors and factors. Is it good to do? Of course. I mean, they're your own stem cells. If you can stimulate more of them, great. But are you going to get to the level that you can get with like a treatment, especially localized into certain areas? Unfortunately, no. That's where you have to.
Stem cells. They were injected in my knee and then the treatment.
Oh yeah, you can combine it. That's why I mean, like with our red light therapies, that's a lot of times what we do. We have like one of the red light beds. So when we do the IV therapies, for example, a lot of times we put the patients there to get kind of the dual benefits of there. Yeah.
All right, well, thank you. We have, do you hear him?
Okay, wow, great presentation, thank you.
Thank you.
So about placenta stem cells, how much do you know about those? And I've understood that you can actually use placenta stem cells if somebody has cancer because it actually fights cancer. I've read about this, other doctors, but you know, they kind of, the verdict has been out a little bit, not a discussion around it. What do you know about that? And what do you think about placenta stem cells?
So I will say that's a little bit more Dr. Suya's specialty on the placenta stem cells.
I'm sorry?
Dr. Suya, my medical director. But from the understanding that I have, it's somewhat similar in that you're still stimulating kind of the immune system. So there are placenta stem cells, and then there's the placenta where it gets essentially lyophilized into a powder and it gets like injected. That's more you're stimulating the growth factors and stimulating your own body. In that sense, I think that would be safer for cancer, but if you're trying to make like stem cells out of them, I think you run into the same problem of the umbilical cord stem cells, because you're still doing stem cells that are targeting your immune system. You're still stimulating the immune system, you're still promoting cell growth, angiogenesis, and that's kind of like Ivan said, you don't want angiogenesis around cancer. That's actually what cancer is trying to do, is form these blood vessels to get more nutrients in it so it can expand and grow. So you want to kind of limit that as much as possible. For us, especially in Mexico, as cancer is like the big no-no for stem cell therapies, that we have to make sure we screen and make sure nothing happens there. We have the other alternatives, like I mentioned, which are the dendritic cells, the NK cells. We can do hyperthermia with hyperbaric and high-dose vitamin Cs with B17. So we have a lot of other things that we know work and work really well for cancer, and not have to kind of risk tapping into that, at least until there's a little bit more information and research.
Yeah, I just want to find out what you know about it, because there are quite a few doctors that actually are using it with people with cancer and to fight cancers at this point. So I mean,
I've even heard like for mesenchymal, there's a few doctors, but again, it's still a little bit of
there's a lot of So you and Yvonne are working together, right, on a project.
Yeah,
so could you or go into that a little bit? What are you actually doing together? Okay.
Yeah. So we're setting it up right now. We met recently, and we found out that the therapies that we both are kind of doing, they could be very synergistic. So with the gene therapy he's doing, it's promoting the angiogenesis, especially in the capillary and the muscle groups. That is something we already kind of do a little bit with stem cells, but not to stem cells are not primarily focused on that, right? They're kind of doing a broad effect. So with his gene therapies, we're hoping to get that broad effect, the inflammation, the immune modulating effect, but at the same time provide that really big boost to angiogenesis, to the formation of new capillaries. And in theory, obviously, if there's more blood flow to that tissue or to that organ, then the stem cells are also going to work a lot better. So they should kind of help boost each other up together. So we're going to have something soon there at the clinic for.
Understood. So right now, because you're in Tijuana, I assume that people can go to you if you were actually doing gene therapies there, correct? Yeah. And of course, otherwise, we have to go offshore to wherever, Honduras.
Yeah, so to be honest, that's why we've been in Tijuana 26 years. We make it easy. You just have to get to San Diego, whether it's plane, train, or car. We pick you up. We're 10 minutes across in a hotel, kind of how RadFest was. You're inside of a main hotel of the city. We do the treatments. You can stay there, and when you're done, we take you back to your car, train, or hotel or airport. It helps us to, one, kind of keep the prices down for our patients also, while giving them good quality treatments. Right. And it's a lot easier than flying across the globe to, South America, like really South America, or Thailand.
Yeah, that's a great access for us, Tijuana.
Yeah.
100%.
So that's why we're there.
Yeah, are you still doing the holistic dentistry then, too?
Yeah. That's actually essentially half of the business is holistic
Exactly, so
dentistry.
you're doing
and
the
other
stem
half-
cells now, and okay, great, because people need to know that, I mean, you guys do amazing work in dentistry.
Thank you.
And been doing it for a long time. And
Yeah.
your father started that business, didn't he?
He did. 26 years
and you-
ago, we were one of the first in the area to do holistic dentistry, trained by Dr. Hal Huggins. I
Yeah.
don't know if anyone's familiar with the name, but he was kind of the father of holistic dentistry. When he was alive, we were one of the 2 clinics in Mexico that he would send his patients to that couldn't afford treatments here because it's very expensive here. And then from there, we started expanding. Now we combine the 2 areas. So basically, all of our dental patients go through medical. All of our cancer patients, for example, get dental check to make sure they're not dealing with anything in their mouth that could be affecting the cancer too.
Beautiful.
Yeah.
Well, thank you so much.
Thank you.
Awesome.
Thank you.